Welcome doctors, let's get straight to it. Private practice forums are full of conversations we all need to hear because they reveal the hidden revenue killers that are costing small practices 10 to 15% of their income every single month. One billing specialist put it bluntly, "I often see small practices losing 10 to 15% of revenue just because claims aren't managed aggressively." And when you look closer, the reasons are the same everywhere: claim denials piling up, prior authorization delays, staff who are completely overwhelmed with AR follow-ups. Sound familiar? And then there's the payer negotiation problem. For big hospital systems, sure, they can leverage size to get better reimbursement. But small and medium practices? The forums say the same thing over and over. Very difficult to impossible to get better pay from insurance companies when you're small. Some doctors even admit they're making well under Medicare rates with commercial payers. That's the reality. But even beyond reimbursement rates, the real revenue drain comes from AR follow-ups and denials. Claims slip through the cracks. Prior auths don't get processed correctly. Eligibility checks get rushed. And then payers quietly downcode, cutting your reimbursement without you even realizing it. And the worst part? One bad week of backlog can easily turn into months of chasing unpaid claims. Doctors are calling it what it is: insurance denials quietly kill momentum, and they're right. Every payer has its own process, its own timelines, its own appeal hoops. Without a dedicated denial management system, you're losing money every day. So what's the solution? Some say it starts with prevention credentialing done correctly, tighter front-end checks, and clear workflows. And that's true. But most small practices don't have a dedicated credentialing team, or a dedicated AR team whose only job is denial management. Your staff is already drowning in day-to-day tasks. That's why the conversation is shifting toward virtual RCM specialists. These aren't generic assistants, they're trained billing experts from India, Pakistan, the Philippines, people with healthcare administration backgrounds who live and breathe revenue cycle management. They do the things your staff doesn't have time for. They track every claim so nothing slips through the cracks. They handle AR follow-ups day in and day out, instead of letting backlogs pile up. They manage prior authorizations, eligibility checks, denial appeals, and even credentialing support. And they do it all at a cost that's predictable, under $2,000 a month. Think about it. If your practice is losing $5,000 or more each month to missed claims, denials, and downcoding, a dedicated virtual team doesn't just pay for itself. It recovers money you didn't even know you were leaving on the table. Doctors are already reporting huge wins. One family practice recovered $47,000 in written-off claims in just 6 months. A multi-specialty clinic cut their prior authorization time from days to same-day approvals, improving patient satisfaction. And solo practitioners are reclaiming hours every day that used to be wasted chasing claims. And here's the best part: it all integrates with your existing EMR. No upgrades. No new software. Just specialized, HIPAA-compliant billing professionals who keep your revenue flowing while you stay focused on patients. So doctors, the question is simple. How much longer are you willing to lose 10 to 15% of your revenue to poor claims management? Because the truth is, you can stop watching claims slip through the cracks. You can stop losing sleep over AR backlogs. And you can finally get paid properly for the care you deliver. The solution isn't more stress for your staff or waiting for AI billing tools that aren't ready yet. The solution is specialized human expertise, virtual RCM specialists who make sure your revenue cycle actually works. Stop losing revenue. Start recovering it. And start running your practice the way it was meant to be: profitable, efficient, and focused on patients. Thanks for watching.